Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're talking with radiologist Dr. Neil Patel. Dr. Patel, great having you back.
Thanks for having me. I'm glad to be back.
Dr. Patel, today we're gonna talk about radiology. Could you please tell all of our listeners exactly what a radiologist does?
A radiologist's main job is to interpret images, medical images, to help guide in treatment of medical conditions. At the end of the day, their main job is to interpret the images that are provided to them and try and concisely gather the information and give a concise report about what the findings are that may be going on inside of your body.
I got you. I understand. So very complicated. A lot of book learning with this, I'm sure.
A lot of book learning, a lot of anatomy. There are many different types of modality that a radiologist would interpret. So things that your listeners may be familiar with: ultrasound, MRI, nuclear medicine studies, CT scans, of course, X-ray, mammogram. So a wide breadth of imaging modalities. So a lot of reading for sure.
Wow. Sounds like it. Now, what type of training and education do you need as a radiologist?
So radiologists go through a general medical education just as all doctors do. So 4 years of medical school. After that, a radiologist will do an intern year, which is basically a general medicine year. The point of that year is just to familiarize the physician with the general medical system. After that, you'll do 4 years of general radiology.
Now, wait a minute. Right now, you're at 9 years.
9 years already. So you do 4 years of general radiology. Most radiologists after that will go on to complete a fellowship, which will be another 1 to 2 years.
That's a lot.
A lot of years.
That's a lot. And then continuing education after that.
Continuing education, you have to do 50 hours a year of continuing education. So there's a lot of continued learning.
Yeah, a whole lot of things, a whole lot of new things happening all the time.
Imaging is one of the fastest changing specialties in medicine, and so there's a lot to keep up with for sure.
Now, let's talk about board certified. What does it mean to be board certified?
So board certification is a test that you will take. It's actually a multi-part test that is required during residency and then after residency. So you take the first portion of your test at the end, pretty much at the end of your residency, and then you take another one about a year after you finish your residency.
I got you.
And it's a computer test. It's a 2-day, 10-hour kind of grueling test. It's actually given in Chicago and Phoenix. So you have to travel and go sit in front of a computer. It's a mix of images as well as vignettes, case vignettes, to try and test your knowledge.
You know, is that important to be board certified? And if so, why?
I think personally it's important. It's a standard that the American College of Radiology and the American Board of Radiology sets to try and standardize the care that we're providing to our patients. I believe it's important to be board certified. All of our radiologists are board certified, so I believe it's important.
Very important.
Very important.
And very, very good to have that at Hamilton.
For sure.
Yeah, I agree. Now, can you tell us about the newest cutting-edge diagnostic imaging equipment that you have available at Hamilton Healthcare?
So this part is very exciting to me. I came from Memphis. I did my medical school and residency in Memphis, and then I did my fellowship at Johns Hopkins in Baltimore, Maryland. And so Hamilton is really putting the emphasis on having high-quality imaging services, and that starts with equipment, of course. So we have many new pieces of equipment that we've brought in the last couple of years. We've got new mammography units, the GE Pristina mammography unit. We now have 3 of those. We had 1 to start, and now we have 3. All of our units are now that high-end model. We also got a complete new fleet of ultrasound machines. They're Samsung. Many of y'all have Samsung monitors hanging on your walls at home.
Right.
They make great TVs. They also make great ultrasound machines. So we've been able to use those. We have new equipment coming. We have a new 3 Tesla MRI that's already installed at Hamilton Diagnostics Center, which is on the Hamilton Medical Campus. And we're using that for high-end MRI imaging.
So much new equipment. Why is that so important that you have the latest technology?
Well, as imaging changes, technology changes. So better technology allows better resolution of imaging. And so the better resolution or better image quality you can provide to your radiologist, the earlier diseases can be detected, the more tailored treatment can happen. You know, we talk about it with, for example, televisions. 10, 15 years ago, we didn't have 4K TVs and all this resolution. And now,
that's true.
And now we have that. So it's very similar in that the better quality image you can provide, the better the interpretation can be and the earlier diseases can be detected.
Dr. Patel, now, do you guys read for other facilities that are owned by Hamilton Medical Center?
Yes, we do. We actually read for all of the Hamilton-owned facilities. So that includes Convenient Cares, including Dalton Convenient Care, Murray Convenient Care, Ringgold. So we're excited to be reading for all of those locations. You'll get all of our services that are offered at those locations. A board-certified radiologist will be reading for those locations.
So even if you're not close to Dalton, but you are close to one of those areas, you can still get it read from one of your board-certified radiologists.
That's right. Anywhere where Hamilton has a presence, we're happy to provide our services there as well.
Well, that's great news. See, I didn't know that. That is fantastic.
We also offer procedures at the hospital and at the outpatient center. Most people do not know that radiologists do procedures. We don't just sit in dark rooms and look at images. So we have the ability to offer needle biopsies and fluid drainage, depending on what your needs might be. So,
right. Dr. Patel, before you go, tell me the difference in a radiologist and a radiographer.
So a radiologist is different from a radiographer, which is also different from a radiation oncologist. A radiologist is what I am. It's a board-certified physician who's been through radiology training through medical school and then through fellowship if they choose so. A radiographer is actually one of the first people you'll meet if you come to get a test performed. And it's the technologist who's actually trained in acquiring the images, which will then be presented to us. So their specialty is to know how to position the body.
Well, I was going to ask that because when I've had this done, they get you in a certain way, and then they do it, and then they move, and they do it again, yeah.
Right. And
so they're the ones who set you up.
Right. They set you up to make sure that they get the appropriate images of your body that we have predetermined and decided that we need to help diagnose the problem. They don't have expertise in interpreting the images, so lots of patients will ask them, well, what do you see?
Right.
And they'll tell you, well, I'm not a physician, or I'm not the radiologist. But that term radiographer is somewhat of an older term and can be sometimes confusing. And then you have a radiation oncologist, which is completely different than a radiologist. We have similar names, but a radiation oncologist is also a physician, and we have a great group of radiation oncologists here. The radiation oncologist is actually using radiation to treat typically malignancy. So
absolutely,
they guide radiation to treat malignancy.
Which is completely different than
totally different. We're more on the diagnostic side.
Very similar names.
Very similar names. We're more on the diagnostic side. They're more on the treatment side.
I got you.
So we're diagnosing the problems. They're trying to help treat the problems.
To make an appointment for imaging at Hamilton Diagnostics Center or a mammogram at Peeples Cancer Institute, call 706-272-6565. 706-272-6565. This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.